Welcome to Coffee with the Mayor, Mark.
Thank you for inviting me, Mayor Lou.
Hey, this is our third edition of this little podcast we're trying to do to create opportunities to educate the citizenry of Hillsboro about what's going on, like some of the exciting things that are going on in the community. As CEO of our community hospital and clinic, I know there's a lot going on out there, but before we get started talking about the hospital, maybe let's talk a little bit about who you are, because I know you came here in the fourth grade, but like me, or you were 4 years old, excuse me, I was in the fourth grade when I came to Hillsboro. So sometimes that still makes us outsiders to some people. But tell us a little bit about your history and what brought you to this position as CEO.
Yeah, well, family came here in '69 to work at the dairy. Dad ran the ice cream department. Mom worked in chemistry, and I have two sisters, one brother, and we all attended Hillsboro High School. And from there, went on and went to college and got educated and entered our careers. And through that process, found there was an opportunity here in Hillsboro and decided to come back and see if I could have an impact at the hospital.
Well, that's great. We're excited that you're back in town. I know you have spent a number of years in your career in healthcare, and tell us a little bit about that.
Started out in healthcare around 1989, basically as a consultant, and the hospital I was consulting for offered me a position. Started out in IT there and worked my way up through the VP and COO and CIO, progressing. And it was a good run, did a lot of great things there, and then wound up back here in Hillsboro.
Yeah, that's awesome. I remember getting the call that said that they were considering you for that position, and what did I think about it? And I remember actually kind of tearing up and thinking, what an answer to prayer that is to actually have somebody from our community that's got the requisite experience and you know, to come run our hospital. So I think that Hillsboro is very fortunate that we could draw you back in, and certainly appreciate the service component of that call back to Hillsboro. So
it definitely did feel like a call or a mission back to see if I could have a great impact or not. I've never really left. I mean, even though I worked somewhere else, I've always remained living here for the most part. Always tried to stay engaged in the community, on the school boards or on some boards, or volunteering somehow. I just think this is an outstanding community. A lot of positive things are here.
well, certainly appreciate that service, Mark. I know you've been on the school board for quite a while. I mean, how many years were you on the school board?
We think around 20.
Okay,
Thank you.
well, that's
Feels like 30.
a lot of service, and I know, I think you just got off this
I
year.
did. January, I was my last. I ended it. So.
But like Matt and I, going through COVID was a big challenge for the schools. I know, just like it was for us here at the city.
Oh, definitely. COVID was definitely a challenge at the schools and in healthcare. You know, I think I started 1/20 of 20, and about 45 days later, the pandemic was announced. So we immediately went into that. And, we at the hospital, I think we did an outstanding job for the community in the county. You know, we formed some great partnerships, held some great pods for vaccinations. The hospital jumped right on with PCR testing and rapid testing to meet the needs of the community. We went to businesses and performed vaccinations in the businesses so they could remain operational, and their staff could convenience for their staff. And we put up outside testing, and I think we did we hit that pretty good, hit it pretty hard. We did a great job internally with the COVID patients and adjusted everything as we needed. We were pretty agile through the whole thing. One thing about that is we really built a good team through that process, because in struggle, you build good teams, and that actually gave us the opportunity to build a great team in the midst of the pandemic and build great partnerships.
I know you've been working closely with the folks over at St. Luke and Marion, and I just really think that's critical for small communities and small counties like the county of Marion, and of course the cities of Marion and Hillsboro. We can do more together than we can separately. So I'm really encouraged by that.
Kind of my slogan to that whole thing is we're better together. through that. And, just being able to share resources, supplies, different things, just be able to have a committed healthcare focus for Marion County between the two facilities is very positive, and working well together is outstanding. I mean, it's been a really good thing for both facilities, I believe, just to have that ability to open discussion. How can we move Marion County health further?
For sure. The cost and of resources, of course, is always a factor. But the idea of staffing and things of that nature are another huge issue, let alone having the right equipment, but then being able to be staffed to address those areas is a challenge, I'm sure.
That's one thing I definitely want to say about our team we've built. We went through the pandemic, and you'll hear about a lot of agency nursing, being a big thing. We did not use agency, for quite a while. Once we got there, we had quite a bit of agency in the hospital, and through about the course of 9 months, we eliminated the use of agency nursing in the hospital and went through the pandemic with just our team, which is in Kansas, well, anywhere. That's pretty rare. Yeah,
That's
I'm pretty proud of that.
Pretty impressive.
Yeah, I mean, we've got a great team. They're very dedicated to our community and the healthcare of it. So,
well, I know, and not to spend a lot of time there is to know that you had a lot of loyal staff that went through a lot with you and are still there, which, again, I think is just a lot of answers to prayers. And certainly from a community standpoint, we are very fortunate to have a hospital, and not only have a hospital, but have a hospital of the quality that we have.
Definitely.
There's a lot of communities our size that have no hospital.
And fewer every day. So yes, healthcare is a struggle, like everything else, but you read more and more nowadays about hospitals closing due to financial situations. And it's just, if you have a local resource, one thing is to keep it, you have to use it. So that's something I just want to emphasize here. We are a great team. It's a great facility. If you're out and you have to get acute care outside of here, you can always come back to home, come back to a great team, great facility, great community, and finish your care up.
Oh, that's a good point. That's a good point. I know that, I don't know if I'm using the right terminology, so you can correct me when you hear me saying something wrong, but we used to call it swing bed. So when somebody would go out and have, as you said, an acute or critical injury, and then there was some repair time or downtime that they needed a higher level of care, and they could get it home. And I guess we used to call it swing bed, but maybe that's not the right term today.
No, that's still a term today that was created in the 70s exactly for that. After a 3-day acute stay, you can move to a swing bed status or skilled status, others know it as. You need additional care, you need rehab, you need additional medical care, but not to a seriously high acute level. So we are participating hospital critical access hospital with the swing bed program. So you're exactly right. It's usually, after 3 days or so, and your injuries or your illness requires a little lower level medical care, but still requires rehab to get your strength back, some dietary, speech, occupational therapy, all that we provide.
That's great. And, I want people, as you said, to keep that in mind, that those services are available, because let's face it, in these inflationary times with the cost of fuel and everything else going up, it's not a bad thing to be able to not have to drive a long ways to go care for or see a loved one that may be requiring care. So I'm glad that we have that here. But since you've come on board, you've also added a number of services that the hospital offers, and I know one of them, not to get too out there, but my wife has been able to get her annual mammogram now here in town without having to travel, which has been great. We appreciate that. And so what other things are you guys doing?
So we'll stay in the radiology department. Since I've been there, we've gone fully digital. We're all PACS, so that's picture archiving computer system. So everything's digitalized, no reports. So we can send your reports to other facilities or physicians if needed. So very convenient, have your diagnostic imaging done here, and then it can be sent anywhere. We're part of a spoken hub of sending anything to basically anywhere that you go. We can send your diagnostic imaging studies to. We replaced our digital room, which is your standard X-ray and fluoro. We replaced our ultrasound, and we replaced our CT as recently as last December. So we got a brand new CT. So we're fully digital out there. It's outstanding department, great staff there. You're not going to see anything any better anywhere else, and it's right here. So yeah, it's a great thing to have close too.
Sure.
So, and then we've same in our lab department, as I mentioned, we brought new analyzers in to address COVID and other things that we do. We're working at expanding our in-house services there also. PT, we've done expansion of equipment, replaced most equipment in our physical therapy department. We've got PTAs, speech, and occupational therapy out there, great staff there. Through the clinic, we've expanded providers. That's another thing we worked with St. Luke's on. We brought Dr. Weirs, both Brian and Autumn, into our communities. They live here within our communities. Expanded ER physician. Dr. Morgan's been down. He covers all of our weekends. So we're one of the few probably that have a doctor in our ER for the weekends all the time.
Very helpful.
Yep. We've expanded our surgery department greatly. We bought new video towers, some other things that people may not understand what they are, but it's very well equipped at this time. Brought in a full line of specialties, orthopedics, urology, which as a local person that was born and raised here is our urologist that visits us, Julie Ann Rapham. Got Dr. Posky. He's a Cincinnati trained podiatrist, so he's good to perform surgeries on anything basically below the knee. He comes down and visits us. We still work with Lane Reeser very closely, cardiology. We've got a new pain group that we're starting up with now that can expand some of our services. There's Dr. Jason Burke, and then he has Dean and Sonia also that comes down and they visit with us. And they can address any pain situations or needs. Brought Dr. Gerlot on, as we all know. He's a great guy.
Yeah.
And then we retained, Jess and Joshua in the clinic and Gail in our ER coverage too. So got a lot of change in the last 2 years, a lot of progressing forward. We're committed to the community. As you know, I'm out and we're involved in the community as much as we could through COVID. It was a tough time. We look forward to the endemic and where we can get out and be in the community more and maybe bring on some more services out into the community. Recently, we've had Diane, our dietitian on staff. She sees clinic patients also for dietary or dietitian needs for diabetes education. So we look forward to getting her out.
Did you weight management?
We recently, Jessica Eubanks recently was certified on weight management, and Diane also works with that, with your diet side. So we've, Dr. Weir is on board at Women's Health, which I don't know if we've had in Hillsboro before. So Women's Health, she's a wound specialist, which I also don't know if we've had here. And we've recently started an outpatient clinic wound. So if you have any wound needs, Dr. Weir have a doctor available to review and care for your wounds. We spun that up a couple months ago. We do dots. We do anything and everything in that rural clinic they have attached to the hospital.
And that's a good point. We started talking about just the hospital, but it isn't just a hospital. There's a state-of-the-art clinic attached, and today, in this day of you guys actually still do walk-ins, right?
Yeah, we've expanded to 5 days a week, walk-ins, 8 to 4:30 appointments. That team is very well-rounded. I mean, you've got tenure, you've got new, educated, male, female. So when you look at it to serving the community, we are very well positioned to serve the needs of the community in our rural clinic there.
And I think that's really the point that I was hoping to get at for this conversation is really, I don't know that people in Hillsboro still actually understand all of the depth and breadth of the services that we can get right here in town medically. And I think it's really important. There's a lot of communities that are certainly, as we talked about, underserved And, the fact is that Hillsboro is not one of those. And, we can be very thankful that that's the case. But, if we want to expand past the hospital, I mean, we've got dentistry, we've got optometry, we've got pretty much a broad spectrum of healthcare.
At the hospital, and that's partnering with the local optical providers here in town. So just the partnerships, we got good services here in town for healthcare overall. We really do. We're blessed.
Well, we've got a new facility. I mean, I say relatively new, but what is the age of the facility? 5 years? I was just going to say that. And so, it was built for the future as well. It wasn't just built for today, but it was.
No, I think there's very few small communities that can state that they have a 5-year state-of-the-art facility in their community, a hospital and a clinic both. I mean, that's definitely something to be proud of.
So I know that we kind of did a little connecting point with you guys with our walking trail, where we had our walking trail that goes out to the and I think maybe you've done some things to kind of tie in with that, have you not?
Yeah, actually, I just spoke to this at the Kansas Hospital Association's spring fling. We're, I think, one of 2 in the state of Kansas participating in the national program Walk with the Doc. We were a very early adopter on that, and that's where every month we have a scheduled day that we have a provider or some medical provider with the community to walk that trail. And that trail has been a really good beneficial thing overall. I see a lot of people exercising and moving on that. We're starting that back up again now that the weather's gotten warmer. I think the first one's the 3rd week of May here. It's on a Saturday. We've moved them to a Saturday to, just to help with getting attendance with the community. So, and then every time we walk, we have a provider available and they talk about something and you walk with the providers. So that's a good program.
Well, the way we designed that trail and the route of that trail was not an accident.
Yeah.
And, the whole idea of the trail in the first place is to get people out, get people exercising. And the fact that it connects us to our healthcare facility and our healthcare providers wasn't an accident either. So I'm glad to see that people are using it. I'm glad to see that people are connecting with you guys on it, and that you're using it to connect back. So
Definitely, it's been a great thing.
Yeah, that's awesome. And since we put that trail in, we were getting a lot of requests for, hey, what about a trail here and what about a trail there?
Oh yeah.
Of course,
I can see that.
the only thing holding us back is money.
Yep. Oh, I know.
If we had the money, we'd certainly get started on it today. But anyway, so talk a little bit, if you could, Mark, about what rural healthcare looks like, just generally, just for folks. I mean, I know you've got challenges. What are some of the biggest challenges in rural healthcare today?
One of the biggest challenges in rural healthcare today naturally is reimbursement and meeting compliance, and is getting your community to come back to you, in that acute or inpatient thing. I think that's probably one of the larger things, is that the community is aware that we are there for that need. And it's your neighbors taking care of you, and it's your provider. If your provider's with us, that continuity of care, he's now seeing you in the hospital, where if you're somewhere else, your primary care provider is not seeing you at that time. So continuum of care, I think, is a huge thing.
So future state, I know you talked a little bit about on the scanning, the X-ray, CT and stuff, and the electronic transfer of files, but what about telemedicine? How is that impacting you guys?
We utilize that through the pandemic considerably for telehealth visits. We use it for our psychiatric program we have too, which is another thing I forgot to mention earlier. So thank you again. And we're going to continue to expand that to meet the needs of the community and provide fast, easy access to the community, to our primary care providers and other services that may be always looking to expand services. We've got a couple things that we're working on now that'll be, I think, well accepted and we need here in our community. Not quite ready to speak about it, but there, it'll involve some of that telehealth too. Telehealth is definitely a service that can be utilized for quick, easy access. You can see it spinning up pretty quick. And then that provider on that telehealth visit can kind of do the mini triage to see if you need to be an in-person visit or not. So we're kind of working towards that way in 2022.
Well, mental health is certainly as important and as vital as physical health, no doubt. And we've got, just seen the need for it continue to increase. And of course, during the pandemic, with people kind of locked away, it just exacerbated the whole issue people have with disconnectedness. And I think a large part of what challenges us today in the mental health areas is kind of a feeling of disconnectedness, of helplessness, of hopelessness. And, it's really important as a community that we look at those services as importantly as we need somebody to stitch up your cut, right?
Correct. Yeah, definitely. We formed a partnership with University of Kansas KU to provide psychiatric and behavioral health needs. And a lot of that's done through telehealth with Dr. Locke there. And we're also looking at bringing a little more in-house in 2022, able to address any needs in the community. In-person visits, for example, is what I'm talking about. And you see that need. And I think the last couple of years has really put some pressure on people, and that need is growing as we see it every day.
The exciting thing about a lot of this, and we've been through some challenges, there's no denying that as a community, but if you think about it, when we talk about the last 5 years, so in the last 5 years, we've got a new hospital, we've got a new pharmacy, we've got a new EMS station, and just, I'm sure I'm missing something in that, but the clinic, of course, obviously with the hospital. And I mean, so in terms of the state of the art, if you will, in healthcare for a community of 2,800 and some people, I think we're sitting pretty good at the moment, in terms of what that looks like. But, and here's the but, we've got to make sure that we keep it.
Yes.
And it sounds to me like the way we keep it is we use it.
Exactly. Yeah.
And we don't look elsewhere. We look to home first, and then if we can't get our needs met, then we look elsewhere.
And in rural healthcare, we understand that there's things we can't take care of. That's absolute. There's higher level of needs than what we can provide, but what we can provide is the after that, and we do very well with that. So come back home and utilize those services. And then anywhere you're at with your primary care provider, anything for your ancillary from your lab to your radiology can be done right here at home. You don't need to make another trip out, get on the road, be at risk. You can have that done right here. Results will go to your primary care just as fast as it would anywhere else. So,
right. Yeah, for sure. I mean, if you're talking about going somewhere to Newton or Wichita, their work is not going to get back to your doctor any faster than it does from right here, right?
Here. Yep. And one thing I want to mention, when you think about primary care and you think about urban and metro settings and what they're up against and their challenges, and what we can do differently is we can provide that time, that discussion in the room. We can have that personal engagement and build those bonds between you and your primary care provider. You get out into urban and metro, that's maybe a little bit more of a challenge to have that happen. So
I think
one benefit of small communities, again, is, that personal and the ability to have the time and be able to have that relationship built and understanding.
I agree. Boy, I agree. And, we've got to know a lot of the providers and come to really appreciate them. And you're right, that time that you get to spend with them in terms of that, after even a little bit of the after the visit, because we're all community. We're a part of a community, and your staff is very much a part of this community. And so, yeah, right on. Anything else you think people in Hillsboro ought to know about our hospital and our clinic and what's going on?
Yeah, I think it's important just to always, sometimes when you think about healthcare and you think about advertising for healthcare, that's something that's not on your mind until you need it. So I think the thing that I want to convey is, always keep us in mind, always give us the opportunity to earn your trust in your business at Hillsboro Community Hospital.
Well, we appreciate that, Mark, and we appreciate all the hard work that you put into this and you continue to put in. And as a city, we are partnered up with the hospital. I mean, it's just part of the investment the community made to ensure that hospital was built 5 years ago. And we're working together to ensure that the investment the community made is getting recouped, and it is. And I'm just couldn't be more happy with with Larry Arthur and the ownership group of the hospital and their commitment to this community. But more to the point, your commitment and being a Hillsboro native that's here, and understands the community like nobody else they could have ever found. So, Mark, thanks for coming in today. Thanks for sitting down and having coffee with the mayor, and look forward to hearing more good things about the hospital in the future.
More to come. Thank you, gentlemen, for having me.
You're welcome. Have a great day, Mark.
You too, Matt.